Hello, everyone. We are back, and today in our AI live tech talk, we will talk about responsible AI in context of healthcare. So, first of all, I would like to give you a little bit introduction about what is responsible AI, and then we will take your questions around healthcare when it comes to responsible AI. So, responsible AI is a framework, and as the name suggests, to make AI responsible. I will mention two of these frameworks. One is from European Union, the other is from here in the US, specifically from Harvard University. The one from European Union is a paper on responsible AI, key themes, concerns, and recommendations from European Research and Innovation. They brought out a good summary of what responsible AI entails. The first, obviously, is responsibility. It relates to issues and considerations regarding what we cannot do with artificial intelligence. What are the responsibilities from a legal perspective, from a moral perspective? Just because we can do something doesn't mean we can do it. The second is around transparency. And we talked about transparency last time as well. It really relates to what kind of transparency requirements do these AI systems and algorithms need to have, so that there's a clear justification, there's a clear way to evaluate, there's a clear way to do quality assurance on these systems. And also there's a clear way to make business decisions using these artificial intelligence systems. Transparency is also very closely related to sometimes explainability, although we contest that you don't need an explainable system for a system to be transparent. The third is regulation and control. What kind of regulations need to be put in place? For us human beings, we know the Napoleon Code is there, which is what our legal system is based on. The next is how will these AI systems impact us? So the social economic impact. And then lastly, the design. Some of the design consideration when making these AI systems or these AI algorithms when it comes to a actual product. A good example is actually in healthcare. So all these things, transparency, ethics, social economic impact, design, are all related to responsible AI. The second framework, which is more or less related, is from the Harvard University, and they call this principled AI. Some of the themes they mentioned that includes principled AI, and if you ask me, it's more or less the same as what responsible AI is importance to international human rights, promotion of human values. Just because you can collect a lot of data doesn't mean you can use it in any way you like. Professional responsibility. What responsibility do we have as professionals when using these AI systems? That could be for doctors, that could be for legal professionals, that could be for engineers. Human control of technology. How much control does human have when these systems make decisions? It could be autonomous weapons, it could be simple algorithms to figure out whether you could enroll in a specific school. Human in the loop is what you folks may have heard about. Fairness and non-discrimination has been an important factor, and that's also one of the key themes in principled AI. Are these facial recognition systems biased? The answer today is yes. What can we do about it? Transparency and explainability, as you remember from the last framework, it's also here, but explainability is much more clearly mentioned. Safety and security relates to what these systems can or cannot do. Autonomous weapons to healthcare systems to automatic decision making. Accountability is an important one. Who is making these systems? Developers, the engineers, the product managers, the head of a department to the CEO, as to the system integrators, to anyone who was responsible for deploying these systems at various levels. And lastly, privacy. And privacy is, if you ask me, one of the most important factors that's becoming more and more important, whether it comes to big technology companies or it comes to startups. With this, let's take your questions. Our first question is regarding doctors. If AI are able to replace doctors and perform operations for the patient, some possible cause of death of the patient can be caused by the incident of AIs when performing operation. And the question is, when do you think it will take place? So there are two questions plugged together in this. One is the technology aspect. Can autonomous systems powered by artificial intelligence perform some of these operations? And the answer is yes. They are available today for simple surgery, and in some of the surgeries, especially where that involved internal organs, robots powered by artificial intelligence can actually do the job much better today. And yes, there is legal liabilities, or there are issues when something can go wrong. And that comes to the second part: who is responsible for some of these actions? Most of the systems that at least I know today have some kind of human in the loop, where the doctor is working hand in hand with an autonomous machine or an AI-based system. So in essence, the doctor is the one who recommends the machine to do something. Or in another way, it's the machine is being driven by the doctor or a set of doctors. And to some extent, that makes sure that from a business perspective, if something goes wrong, it is the doctor or the hospital who is responsible. You cannot actually blame it on the machine itself. The other way to look at the same problem is, well, who created that autonomous system that's doing the surgery? Did they follow the right processes to build those machines? Did they did enough diligence to make sure the data that's being used to train these systems, and especially in this case, autonomous robots that perform the surgery, has covered all the boundary conditions, for example? And in that sense, there is some responsibility that is also on the manufacturer of the robots itself. But as we see that some of these regulations are still not defined, and there is a inherent and urgent need for some of these regulations to get in place sooner than later. This cannot wait for exactly the issues that was pointed out, that an operation could be done by a machine, but what if something goes wrong? Who's responsible for that? In the next 5 years, I do believe, because of such surgical machines which are doing most of the work themselves, these machines, and in some cases these machines could be controlled in a remote fashion, where the machine is doing most of the work, but the doctor is still involved, which is directing the machine to do what it needs to do. In those cases, these things will be a lifesaver. It's a luxury in some of the countries like the US or the Canada or in the UK, where we have doctors available. There's a lot of countries in the world where that's just not possible, and telemedicine, which has becoming much more prominent due to the pandemic, will become much more important. It will be a lifesaver. Let's see if you have any other questions. While we're waiting for the question, just wanted to point out the whole concept of robotic doctors is nothing new. It has been there in place for a while. And the question here was, how much can we automate that? And at some point, that automation will reach a level where it's more or less the machine doing everything. There's another aspect that would be worth talking about, which is the doctors itself. Artificial intelligence, with help of techniques like deep learning, could process lots and lots of data and is able to diagnose patients better because these systems are trained and can process so much data. The question apparently comes is, will these automated decision-making systems replace doctors? And my answer is no, it will actually not replace doctors. And the reason is very simple. You cannot replace that simple gesture where the doctors looks into your eyes and say, don't worry, you will be all right. I'm here with you. And that is not something you can replace by autonomous decision-making system, however good it is. So where we are going is where these autonomous AI systems, either in software or hardware, work hand in hand with a doctor to administer a patient. Our next question is, when technology doctors perform the surgery wrong and cause possible death to its patient, who should take the responsibility? There's this idea about liability when it comes to questions like these. Who did something wrong? And I believe it varies based on country to country. In some countries, it's where the definition of who can be responsible is different. At least in the United States, the definition is much more pragmatic, where it has to do with the full value chain, whoever was involved in doing that surgery. And as all of you may remember, that when you go to a doctor, or in that sense, when you go to anywhere where you are doing something that is adventurous or could result in something going wrong, you do sign a waiver. Even if they forget about those aspects, I believe, at least in the near future, the machine will not be fully responsible for surgery or for operation or for diagnosing you with something. Which means is that whoever is responsible for running the machine, which is probably the hospital or a set of doctors or a clinic, they will likely be responsible for what happens. But again, these questions are becoming more and more important, and especially as these systems come online and these systems become much more capable of doing the surgery and diagnosis themselves. This is the very basic reason where we need to come up with regulations that are very specifically meant to regulate artificial intelligence, how it's being used. And not only that, we need to not just think about what could happen today. We need to think about what could happen in 5 years or 10 years and create regulations that could cover that. And autonomous systems in healthcare, or decision-making systems in healthcare, from a surgical machine to diagnosing if somebody has a specific disease, are a great example of that. The technology is there today. It will save a lot of lives. It will make healthcare much more accessible to a lot of people. if we could answer some of these questions, or if there's a regulatory framework that is in place that could help the doctors, that could help the clinic, and that will also get the patients to be much more comfortable when getting into a hands-off autonomous robotic doctor. Thank you. Again, we are Skive. We are obviously hiring, so please feel free to reach out to me or any one of our staff if you would like to work with us. And as always, if you have more questions, feel free to reach out to us on Facebook or LinkedIn, or you can email me directly. Thanks and have a great day. Bye.